2-hydroxyglutaric aciduria is a rare inherited metabolic disorder characterized by the accumulation of 2-hydroxyglutaric acid in bodily fluids. This will eventually lead to the progression of neurological impairment. Due to its rarity with only fewer than 150 reported cases as of 2024, diagnosis for 2-hydroxyglutaric aciduria or 2-HGA is often delayed and treatment options remain limited. But understanding this disorder is crucial for early detection, for treatment processes, improved patient management, and potential future therapeutic interventions.
Diagnosis for hydroxyglutaric aciduria, or 2-HGA, has 4 ways of diagnosis, such as: first, using MS/MS, an advanced analytical technique used in mass spectrometry to analyze complex mixture of molecules to identify biomolecules of metabolites. Second, the urine organic acid analysis is a laboratory test to detect abnormal acids in urine for HGA. Third, the plasma and cerebrospinal fluid, or CSF, analysis by measuring levels of abnormalities, since HGA is primarily a brain-associated metabolite. Lastly, the genetic testing, which is more important to confirm the diagnosis of HGA, such as gene sequencing.
Etiology is a term that means to describe the causes or factors that lead up to this disease or what causes it in itself. And 2-hydroxyglutaric aciduria or 2-HGA has multiple types of gene mutations, including L2-hydroxyglutaric aciduria, D2-hydroxyglutaric aciduria, and the combined mutation DL2-hydroxyglutaric aciduria. And each genes hold L2-HDH gene, D2-HDH-IDH2, and SLC25A1. These genes break down the enzymes within the cerebellum, which help coordinate muscle coordination and balance within an individual and their body. And from these genes, they're autosomal recessive. So that in itself means that the parents do not have these genes, but somebody from a past generation did, which then is inherited and skipped over like this. And the buildup of these genes within the enzymes break down the compounds and cause cell damage and brain damage within the cerebellum in itself, and causes like seizures and neurological dysfunction.
Symptoms for 2-HGA typically manifest in infancy or early childhood and progresses over time, often to significant neurological decline by early adulthood. It's also important to note that symptoms and severity will vary according to the strands and subtype of the disorder. General symptoms of 2-HGA will present in individuals such as developmental processes delays such as walking and sitting, and likewise individuals will also be challenged in articulating words and forming coherent speech patterns. Observe that individuals will also have reduced muscle tones and their muscles have become weak, leading to floppy or droopy behaviors. Structural changes are common for all subtypes, where changes in the structure of the brain, cerebrum, cerebellum are seen through imaging. Seizures and epileptic episodes is also common across all subtypes. Severity and frequency will also vary accordingly. Note that for D2-HGA type 1, it will show all of the common symptoms as well as for type 2. But for type 2, it will start earlier and it will be much more severe. One key symptom for the D2 subtype is cardiomyopathy, which means that their heart is enlarged and their heart muscles is weakened. For L2-hydroxyglutaric aciduria, again, general symptoms, but the most prominent symptom is macrocephaly, which means that their head is abnormally large.
Okay, so we are now on the treatments available, and as a rare disease, unfortunately, there are still no known treatments for 2-HGA. However, there are some supportive measures like seizure medication, as we now know that seizures are a common symptom for this disease, and so most people will take seizure medications to aid in their disease, and this is why it is important for cognitive rehabilitation and like neurological evaluations to be able to monitor all of the symptoms and the progress of the person with the disease.
Prognosis is a term that means the progress of the disease, the expected outcomes, and the most likely solutions towards the disease itself. For 2-hydroxyglutaric aciduria or 2-HGA, the person's life expectancy does vary between the individual, but it does stem from early childhood down to late elderly years, as you can see here. And the individual will have its common symptoms as mentioned as before, and with rare cases, it'll stem into other autoimmune disorders such as leukoencephalopathy disorder, which is a form of dementia most commonly seen with elderly care, and it'll depend on the severity of the disorder itself.
The main risk factors is genetic condition or a gene mutation inherited from family history. While it is a genetic disorder, several factors can increase the risk of passing on the disease. There are 2 types of hydroglutaric acid or HGA, as explaining in the beginning of this topic. Both types of HGA occur when the child inherited a defective copy of genes. It can also occur when the affected gene of the child is dominant.
In summary, the pathophysiology of 2-HGA is primarily driven by the deficiency of the enzyme due to genetic defects. The accumulation of 2-HGA leads to diseases which takes progressive courses that cause mental deterioration and other neurological symptoms. To summarize each slide, as for diagnosis, to diagnose aciduria, they identify biomolecules of metabolites. Plasma, CSF analysis, and MSMS are most crucial for the diagnosis of this disease. As for etiology, the etiology of this disease is caused by mutations specifically from AL2H-DDH gene. As mentioned, there are 3 different types of this disease. Combined D-AL2HGA are autosomal recessive traits, and AL2H-DDH is recessive inheritance. As for symptoms, because it is a neurological disorder, we most often see like seizures and delays in development for symptoms. As for prognosis, genetic disorders and mutations alter life expectancy, but it varies between each individual. Treatments, again, there are no treatments, however, there are certain measures as individuals can take to aid certain symptoms that comes with the disease. As for risk factors of the disease include metabolic disorders caused from inborn errors of metabolism, and that is everything for 2-HGA.